It's my pleasure now to introduce Senator Mike Rodrigues, who was born in Westport and graduated from UMass Dartmouth. He's president and treasurer of ABC Floor Covering in Westport. He was elected in 2010, and prior to that he served 14 years as our state representative. I've been fortunate to work with Senator Rodrigues over the years, and I've come to respect his understanding of both business and economic and human services issues. As chairman of the Joint Committee on Commerce and Labor, he led efforts locally for a consortium of community partners to enhance workforce training opportunities. I'm sure we all look forward, as I do, to working with Senator Rodrigues in his new role as chairman of the Joint Committee on Children, Families, and Persons with Disabilities. Thank you for joining us today.
I'll use this one. I will.
Yeah, I'll keep this one.
Hello, everyone. It's really a pleasure to see everyone here. Welcome to the South Coast. Welcome to the Fall River. Thank you, Nancy, for being our host today. And as Nancy said, over my 14-year tenure in the House of Representatives, Nancy has become my go-to person on any and all elder issues. And as I sat here today and heard Helen talk about Francis's story, and I heard Isabella's story, and Danielle, it just reinforced that, why people like myself and my colleagues here got into the business that we're in, because we hear similar stories each and every day as constituents come to us, as family members and loved ones of individuals that need help and assistance come to us for that help and assistance. We have grown to really value and appreciate all of the work that all of you do on a daily basis. I call you all angels on earth doing God's work each and every day, providing for our constituents the services that they need. And thank you for improving the quality of life for those of us that we represent. And Michael talked in his remarks about the fact that it's no secret we're going through a very serious fiscal crisis in the Commonwealth of Massachusetts that, some of it came to light 2 weeks ago when Governor Patrick released what's known as House 1, his proposed budget. And oftentimes that reality is sobering when we see in black and white for the first time what some of the proposed cuts are going to do and how they're going to affect how we do business. And Michael said it, rightly, that he gets it. He knows that there's an issue and he gets it. We also know, I want you to know that all of my colleagues in this room, we know what you do and we get it. And that if it's not for you providing the services that you provide, then there's no need for us as legislators, because we're in the business trying to improve the quality of life of the people that we represent. We heard loud and clear, and we hear loud and clear, both in the human service industry and in the private sector elsewhere, about the cost of healthcare and how it affects how you do business, how I do business, how we all do business, and we're getting more for less. I fully support moving into the GIC system. I've been saying for years, I think every public employee, local, municipal, state, county, should be within the GIC system. What we're getting to, slowly but surely, is what's known as a single-payer system. That one of the complexities of our healthcare system is the fact that there are so many providers, healthcare providers, that we are paying so much of our healthcare dollars on administration and overhead. And it's not the hospital's fault or the doctor's office's fault. You go into those facilities, look at their back office, how many people that they have hired that are just pushing paper to ensure that they get paid and they get reimbursed for the services they're performing. Whether it's Blue Cross or Harvard Pilgrim or United Healthcare or on and on and on. Each one has their own system, their own billing codes, their own methods of requesting reimbursement for services that we're paying, I think, something like 27 cents of every healthcare dollar on administration rather than providing the services, the healthcare services that we should be providing. It's a real complicated, hot debate about the single-payer healthcare system. We hear it all the time, both on a statewide and a national level. But I think slowly but surely we're going to progress that way because it's what makes most fiscal common sense. The other bills that you have as priorities will, I'm not going to speak for my colleagues, but I'm sure they'll get overwhelming support from my colleagues as it works through the process. I was honored when Senate President Murray named me as chair of the Joint Committee on Children, Families, and Persons with Disabilities. It's a little bit outside my traditional wheelhouse of work I've done in the legislature, working on chairing the committees on commerce and labor and workforce development, and consumer protection and professional licensure. But I welcome the opportunity to broaden my knowledge on the issues, and I can tell you that because of working with so many of you in this room, I appreciate the opportunity to continue to work with you as you educate me on the more nuances of the issues as we move forward. So I thank all of you. I really appreciate all my colleagues being here. They're here because, you know, we're really in the same business. We just go at it a little bit differently, but we're in the business of trying to help people, trying to improve their lives, improve their quality of lives, to live in this greatest country in the world, and stop slipping backwards and to move forward. And each and every day in our respective legislative offices, we hear similar stories that we've heard today. So I thank all of you for inviting us here today. Know that you all have friends and allies, and thank you all for being here.